We have found a fairly robust statistical association between blood lead levels through the first 6 years of life and later criminal behavior.
In 2014, the water source was changed in Flint, Michigan to save money, and the drinking water became contaminated with high levels of lead. Doctors say that parents of children in Flint have good reason to be worried.
There's real danger that the injury is going to be permanent and lifelong in them.
Dr. Philip Landrigan is Dean of Global Health at Mount Sinai School of Medicine. He's been studying the effects of lead since the 70s.
The problem here is that no level of lead is safe. Even low levels of lead, especially if exposure to low levels continues over many months, is going to cause some degree of brain damage to at least some of the children.
In Flint, Michigan, a major challenge now will be to identify which children are at risk and then tracking them for years for evidence of injury.
These children are going to be injured for life. They're going to need remedial education. They're going to need educational enrichment programs. They're kids who may be prevented from functioning at their full level.
Lead is harmful to multiple body systems such as our central nervous system and brain, as well as reproductive system, kidney, cardiovascular system, blood, and immune system. Lead exposure is especially dangerous to children's developing brains and can result in reduced intelligence quotient and attention span, impaired learning ability, and increased risk of behavioral problems. As for long-term associations with mental health and personality, researchers tracked almost 600 children born in the 70s in New Zealand.
During that time in history and in that geographic location, levels of lead in gas for cars was extremely high. It was some of the highest in the world at the time.
In terms of personality, the researchers observed lower conscientiousness and agreeableness and higher neuroticism. And for mental health, they observed internalizing and thought disorder symptoms and higher general psychopathology. Lead is a highly toxic metal that is particularly harmful to children because young children absorb about 4 to 5 times as much lead as adults, and it affects almost every organ in a child's body. Even limited exposure can cause damage that is permanent and devastating. There are many sources of lead exposure: lead paint, lead glazed ceramics, some traditional medicines and cosmetics, industrial emissions, lead water pipes. Lead paint is the most common source of exposure for children. They are found almost everywhere and are consumed as flakes when children put their fingers and toys in their mouths. In the 2000s, researchers found lead poisoning was widespread across major South African cities, while more recent evidence shows there is a problem in certain mining and fishing towns as well. And what is even more concerning is that South Africa's Medical Research Council says that we are missing cases of lead poisoning altogether. Jaco Tobias for CRI Radio News.